again with two of my friends here today, Haley Blasco and Sherri Roller, and they just had brand new babies. I worked with them in the past and they wanted to share their story on delivery and breastfeeding. So without further ado, Haley, tell me a little bit about yourself.
I am 32 years old. This is my first baby. I work at a hospital in a special care nursery, so I'm around babies all the time. Sick babies, well babies, preterm babies, postterm babies.
All the babies.
All the babies. And sometimes I work with the moms too, postpartum.
Great.
Yeah.
And Sherri.
I am 29 years old, and this is my first baby as well. And I am a labor and delivery nurse at the same hospital, so I work with all the moms for their deliveries and then also postpartum.
Excellent. So how old is little Presley?
Presley is 3 weeks old. She's 3 weeks old right now.
And you're breastfeeding?
Yes. That's been a little challenging, getting this whole routine down, but I guess a 3-week-old doesn't have a routine, so.
Right.
Yeah. It's tough.
How is sleep? Are you sleeping?
Not really. They say sleep when the baby sleeps, and that's really hard to do, honestly.
Yeah.
I thought that would be easy, like, oh yeah, it's easy. Sleep when the baby sleeps. Easy plan. Doesn't really work that way. She'll either be up every hour or maybe she'll give me 4 hours. Like the longest I'll go maybe will be like 4 hours in between a feeding, but it's so, like I said, she has no routine. She just eats whenever she wants.
That's okay. It's
Yeah.
the way it should be.
Yeah.
Great. And how old is little Ethan?
He is 3.5 months.
And you're basically becoming pro at breastfeeding.
We're getting there. It definitely was challenging in the beginning, just like Haley was saying. It's a lot of hard work. But yeah, he's doing really good.
Fantastic. So tell me, both of you, like a little bit about your deliveries, how they went. Did they go as you expected they would go? I mean, you have so much prior knowledge, experience. I'm sure you had some like ideas of your perfect delivery.
Mm-hmm.
But
My pregnancy was pretty uneventful. I really didn't get morning sickness or anything like that. I didn't have gestational diabetes or nothing was abnormal. Everything went like really well, and she was starting to measure big, and the doctors were concerned, but not too concerned to like schedule a C-section or anything. They weren't jumping the gun there. But they did say she did seem a little large. Anyways, when my due date came and went, and she was still very high. She wasn't dropping, and they did end up inducing me at 41 weeks. And I was on Cytotec, Pitocin. I got as far as 8 centimeters. And she just was not tolerating the labor anymore.
yeah.
Her heart rate was dropping, and they decided it was best to do a C-section. And the C-section honestly went beautiful. The incision, everything healed fine. Like the recovery wasn't bad at all. I thought it went really, really smooth. So I was honestly happy with everything. Like she's a healthy girl, so everything kind of went as it was supposed to, I guess, you know.
Yeah.
There wasn't really any complications other than having to do the C-section. That wasn't that terrible, so
Good.
yeah.
Great.
My pregnancy wasn't as nice, I guess, as Haley's. So I definitely was someone who had the whole morning sickness and lost 14 pounds in the beginning and all of that. And then I also had was complicated with preterm labor after a car accident, which they were able to stop, thankfully. Delivery itself, the delivery wasn't so bad, I guess. Looking back now, it wasn't so bad. I mean, in the moment, I couldn't get an epidural because my platelets were too low. So I had to do it all natural, which was tough.
Yeah.
But I did it. I made it through. Pushing was definitely not something that I enjoyed. So when they would tell me to push, I would tell them no. And it's funny because like I do this for a living, so to be like a patient on the other side, like I knew what I needed to do, but I didn't want to do it.
Yeah.
So, but after, it was all said and done, it probably was only 6 hours of actual labor and pushing all together, so it wasn't too bad.
Yeah.
But then the aftermath, I did hemorrhage and had to end up going to the operating room for a D&C because I was bleeding too much. So there was that.
Yeah. So a D&C is dilation and evacuation of possible retained placenta or products, and there's some blood in there. So if you're hemorrhaging, the uterus can't contract well, and so sometimes they have to go in there and manually remove, like if there's a piece of placenta or something left over. So of course it's like Murphy's Law. The labor and delivery nurse has I don't want to say traumatic, but kind of has a difficult labor and delivery because that's the way it would be. So. So things don't always happen the way you expect, but in the end, healthy baby, healthy mom, that's sort of like our goal always. Okay, so she is 3 weeks brand new,
Yeah.
and so you've been figuring out this breastfeeding thing. Is there any recommendations you have for a new mom, or can you tell us a little bit about how it's been the last 3 weeks?
So I think every new mom is really concerned whether their baby's getting enough breast milk, and you can't really tell unless like you're also pumping too, I guess. So she was just super inconsistent with her feeding. Sometimes she was eating every 1 hour, sometimes she was eating every 4 hours, and I was like, I thought maybe something I was doing wrong. Like, why isn't this kid consistent? I didn't think she was getting enough milk. This is all in week 1. Like you're just overloading yourself.
You're
stressing. Yes, exactly. You're stressing out. And so basically, I would feed her and then I would pump. I would feed her and then I would pump. Then I found like my whole day was just me at my breast all day long. And I did that for like a little over the first week. And I was like, this can't be right. So I talked to my lactation consultant, who is also one of my good friends because I work with her at the hospital. And, she just basically told me I am overthinking. I am stressing out too much. The baby is going to, you're going to produce what the baby needs as long as you're putting the baby to the breast. And yes, the baby is going to be inconsistent. And I really didn't know that. And, as long as I've been, I've been at the hospital working I'm going on 5 years there. And you just think you know everything. But I didn't realize how inconsistent a newborn baby really is. And I think you just gotta just not overthink it. Take it easy. Don't stress out, because stress is gonna mess up your milk production as well. Lack of sleep, which I was definitely having a lot of You're going to have lack of sleep, but I was really overdoing it with the lack of sleep. I didn't have to. But, like I said, she was 9 pounds, 5 ounces when she was born. At 2 weeks at the pediatrician's visit, she was 9.13, so she was getting enough.
Yeah, she was keeping her weight on.
Yeah. So.
Do you know how much she weighs now?
I don't. I have another visit in like a week. So.
Okay. Well, she doesn't look
she
malnourished in any way.
She feels heavier for sure. She definitely feels heavier.
She's so cute. Yeah. Okay, and then so now you're 3 months in. I think you guys are sort of developing a consistent schedule, but do you have any tips for a new mom, or, tell us a little bit about how it's going now for you?
Definitely don't stress about it. I think this, just like Haley said, is a big tip. In the beginning, we did the same thing. You think about, am I giving him enough? And he's definitely inconsistent, wants to eat all the time, and you feel like all you do is breastfeed. But that's the whole point of it, and that's how he brings your milk in. We had definitely a little bit of a challenging time because he had a tongue tie. So he had a little bit harder of a time breastfeeding. His latch was a little off, and for the first about week and a half, he would, he was like cracking my nipples and they were bleeding. So we ended up having to get his tongue tie clipped, and after that it kind of was a little bit easier. But we definitely, we started using a nipple shield to help him with that, and he still loves breastfeeding with a nipple shield, so 3.5 months in we're still using it.
Yeah.
And I tried to get him off of it a couple times, but he doesn't do very well off of it. He just likes that, and it's something that he's used to now. So, you know, I don't stress about it. It's not that big a deal.
Yeah, if anything, it's protecting your nipples.
Yeah.
I mean,
So, but I definitely think, you know, don't stress about it. Feed them when they want to feed. That's, you know, works by supply and demand. So, you know, and I definitely notice, like, if I'm away from him and he's at daycare or whatever when I'm at work, he's pretty good about eating, you know, express breast milk in the bottle. And he eats that, like, every 3 hours. But when I'm around him and he knows that I'm there, he definitely wants to breastfeed more. It's just like a comfort thing. He wants to breastfeed at night to go to bed. And that's just a comfort thing for him. So, but it works.
yeah, so just listen to the baby, and
Yeah.
and he'll kind of let you know. And I think even though you've been both gone through a little period of stress, you know, now as you see the babies gaining weight, definite good poops and pees, that they're getting milk. You just don't really see it in bottle form.
Right.
So it's a little bit of trusting your body.
Yeah. He fell off the growth curve a little bit, or was starting to fall off the growth curve a little bit. But he also has reflux, as you can see. So, you know, but he still was peeing and pooping plenty. They had me keep an eye on that, and he was never starving. You know, he would just need to eat every 2 hours, sometimes every hour and a half, and, you know, so I did it, and, you know, he's definitely getting more of a consistent schedule. And he's doing great.
Yeah. Yeah, he looks great. You can really see the difference in their size. 3 months to 3 weeks. Though she is pretty big. All right. So for both of you, is there any item that you'd say is like a necessity for breastfeeding or while you're pregnant? Was there anything, like a great thing that you'd recommend?
The pregnancy pillow I loved when I was pregnant to sleep at night.
I never had one, and I wish I did. Honestly,
really
I've heard
good.
a lot of good things about that.
Yeah, it was helpful to sleep.
I like the boppy. I do. I use that a lot when breastfeeding her. In the beginning, the first couple weeks, the Lancino like nipple ointment was really
that lanolin ointment.
yes.
Need that.
Yeah.
Great. And I guess for you, you're using a nipple shield, so I'll show like a little picture of what those are, but they're great, especially if the baby has a hard time latching onto your nipple, if you have flat nipples, or if they're so chapped that you need like a little barrier in between you and the baby's mouth. But I guess they can get used to it.
Yeah, he's definitely used to it. His issue was his latch because of he has an upper lip tie and a tongue tie.
Yeah.
I'm smiling, but not for the camera, huh? But it's a great tool. I definitely, if you need it, use it.
Yeah.
And don't stress about taking them off of it. You
Yeah.
know, it's not a big deal if they breastfeed with it.
Yeah.
He's doing just fine.
You gotta just do what you can. So tell me a little bit about prior to having Ethan, I think you were not planning on breastfeeding. What changed your mind?
I definitely did not want to breastfeed before having him. I knew how good breastfeeding was, and you know, I taught it to all of my patients, and I could get a rock to breastfeed, you know, pretty much. But for whatever reason, it just didn't appeal to me. I didn't like the way milk smelled. I just really didn't want much to do with it. And I don't know what changed my mind. I know just having him, and you just love them so much, and you just want to do what's like the best for them. And you know, not that formula is bad, but you know, there's all the research out there about how good breastfeeding is. So I just decided to give it a try, and if it worked, it worked, and if it didn't, I was okay with that too. So luckily or thankfully, you know, it's been working and going well. And I also just think too, like, my boyfriend would joke with me, you know, like, oh, you're not going to breastfeed. I'm going to have formula in the house just as a backup. You know, and he would joke about it, but it kind of like made me want to do it that much more.
Yeah, prove him wrong. So Haley, were you planning on breastfeeding but
I definitely wanted to try it. I was gonna give it a good effort, but but I wasn't gonna have my heart and everything set on it. I find a lot of women, in with my job, I see a lot of women who they have their heart set on breastfeeding, and it just doesn't work out. Sometimes it just does not work out. The baby just doesn't know how to latch, or the mom just doesn't have the right equipment.
Makes them stress that much more.
Right. And so I was gonna try it. I was gonna try it and see how it went. And formula is always an option, and formula is not a horrible thing either. So I was just open to both, really. I was gonna definitely try breastfeeding, but I wasn't gonna have my heart set on it either. 'Cause every baby's different.
Great. How have you found, like, what's the role of your boyfriends? Are they helpful? What could you kind of delegate for them to do so that you can have more time when the baby's demanding more of your time?
So because I'm breastfeeding, they feel helpless. They just feel like they're just there taking up space. But he does change a lot of the diapers, and that is so helpful. And especially in the middle of the night, that will be his duty. He'll do the diapers. And sometimes when she's just really fussy, when she's fed and she's burped and she's changed, and she's still fussy, he takes the responsibility of walking her and bouncing her around the house, and that is also really helpful because that usually does put her to sleep. Yeah, he does. He definitely does his share. He'll when I pump, he'll clean all the equipment. He'll wash the bottles. Takes the garbage out, the dirty diapers out. Like it's
Yeah.
He does his things. Like even though I'm breastfeeding and pumping, whatever. He definitely has his tasks, and he does really. He's a big help for sure.
Now, do you both pump? Or, not to interrupt with the other question, but you both pump?
I
Have you
do.
figured out like a good schedule with pumping?
I still haven't. I kind of just pump on the whim. Like if I know I'm gonna go out, and because I'm still not really comfortable breastfeeding in public yet, or even in front of my family, honestly. So if I know I'm going to my parents' house or going out, I always have a bottle for when I'm out. But I don't have a schedule. It's not like I schedule anything. It's kind of like on the whim. I'll just pump something so I have it with me. I do need to figure out a schedule though, because I am going to go back to work, and I need to have a supply of express breast milk for when I'm at work. So I still have time to figure that out on maternity leave, how to pump.
Yeah, I in the beginning it was definitely more challenging because he wasn't really on a schedule, and I was still mostly breastfeeding him. But I did have somewhat of an oversupply, so I needed to pump to get some of the excess off. So that's how I kind of built up my supply before work. But now that I'm back at work, I pretty much pump when I'm not with him. And my goal is to pump exactly what he needs for the day. So right now he's taking, 5 ounces every 3 hours. So I do pump every 3 hours at work. And I get about 5 ounces, anywhere between 4.5 to 6 ounces I get. Wow. So sometimes I get a little bit more, and it makes up for the next pump that might not be as much. So I try to pump what I can, and then I usually pump once at night after he falls asleep, because I still am awake and I still need that one last. He's not there to eat, so I pump that one last time.
Is he waking up through the night?
He does still wake up through the night. The doctors really don't want him sleeping through the night until about 6 months for a breastfed baby. And he initially was doing really well, but he goes through growth spurts. So right now he's been waking up twice, but it varies. So last night he actually slept from 10 to 6 and didn't wake up. But then the night before he woke up twice. So his schedule is still a little bit off. He's not set at night, but he's really good about waking up, eating, and he goes right back to sleep. So it's, he eats within 15, 20 minutes and he's back to sleep and I'm back to sleep. So it's not a huge problem.
Deal. Yeah. That's good. Do you breastfeed in the morning?
I do. So my routine is I have to be to work at 7 o'clock. So I wake up at 5 o'clock and I take a shower and get dressed. And then I make the bottles because I have I defrost the express breast milk overnight and then put them into the bottles in the morning. Then I go wake him up and he eats on both sides. Then I get him dressed, and then we go out the door.
Wow. You're a pro.
I'm getting the routine down.
Yeah.
Getting done. The first couple times I was late for work a couple times. The first couple times, but then you figure out what you have to do and you get used to it. And I would pump when I felt like super engorged and I felt that he wasn't feeding fully, or not that he wasn't feeding. He was feeding fully to satisfy himself, but I still had extra in there. And so after a while, it would build up. So I would pump when I felt like I needed to in the first couple weeks. And that's how I kind of...
Did you use any like hand expression or a manual pump?
I have both.
There you go.
Manual pumps are nice because you can... It's hard to explain, but you can pump, and once you get a good stream going, you can just hold that pump and the milk just like pours out. So you don't have to... It's not like an electric pump where it keeps pumping. Like you can release it faster.
Yeah, you can stop, you can keep going, I guess. Yeah.
So I keep my manual pump in my purse just because... One day I was stuck in traffic for a little while. Oh no.
What the heck was that?
And I needed to pump when I was in traffic because I was feeling full.
Yeah.
So I keep that on me in case I need it. It comes in handy.
So after you've had your babies, did you guys experience any depression, anxiety, or just baby blues?
I definitely did. I definitely had the baby blues. If I didn't know any better, I would think it was postpartum depression because how severe it was, but it didn't last long. So that's how I knew it was the blues. But I was, the first week, very, very emotional. I mean, would cry over anything. I kind of blew everything out of proportion, and I take a lot out on my boyfriend. He was the only other person with me. Yeah. Besides the baby, and he got the brunt of it for at least for the first week, and it was to the point where he thought, if it doesn't get any better, you should probably go talk to somebody, because I was very emotional, especially, and with her inconsistent feedings, that added to it, and I just didn't think, does she have an allergy? Am I not producing enough? Do I need to go to formula? All this stuff in the first week, and she's only
which is
one
sort of
week
like
old.
negative thinking.
I know, you beat
I'm not
yourself
doing
up.
enough,
right?
In so many different ways.
Yeah, and I'd get jealous of my boyfriend because
he's sleeping.
He's sleeping, and I was I resent him, and his life really didn't change too much. Yep. That's what was tough for me, and that first week or two was very emotional, and it did even out. It did level off, so that's how I knew it was just the baby blues. If it lasted longer, I would definitely have gotten help, because like I said, even my boyfriend was like, you really need to talk to someone if this doesn't get better.
Because it's that intense.
Yeah, it really is. I was like, I didn't even know who I was. I was like, why am I even knew in my head it was probably irrational, but you can't control it.
Yeah. What did you experience, Sherri?
So knowing about baby blues and postpartum depression and all that, from work, I was definitely aware of it. But I did not really know too much about postpartum anxiety, which is actually something that I suffered from. So I would have, it's the same thing. Like, you're tired, you're not sleeping, your other half is sleeping and it kind of just, but for me, I would just get super anxious about him, about things happening to him. So what if I walked into a doorway and hit his head accidentally? And so I would get these crazy visions in my head about me dropping him on a floor, or walking through a doorway and hitting his head, or, him falling somehow or something and getting hurt. And they would repeat over and over in my head, and they would get, really extreme to the point where he was bleeding from his head and all this kind of stuff. And so that definitely took a toll between, I think, me and my boyfriend, because I was so anxious, and I didn't want him to get put down. I didn't want him to go to other people. I wanted to just hold him myself because I wanted to protect him. I think it was really hard. He's inside you for so long, and you're protecting them when they're inside you, and then they come out, and you kind of lose control over that a little bit. Right. So I think that was my biggest issue. But I talked to the doctor about it, and they wanted to put me on medication, but I didn't want that, so I ended up seeing a therapist about it. for a couple times, and you know, working through that. And I definitely think just time, like as he started getting bigger, I felt more comfortable, and the vision started to go away. But that initial couple weeks was definitely a really challenging period.
But definitely you'd recommend seeing like a therapist, definitely talking to someone.
Yeah, it definitely helped to talk it out. And like Haley said, like I knew my thoughts were irrational. Like I knew like this wasn't normal. I knew like I needed to stop thinking like that.
Yeah.
But you couldn't help it. Like I couldn't get those
To stop.
out of my head. Yeah.
Yes. Oh my goodness. Well, this has been so good. I want to say thank you to both of you for coming on and telling us a little bit about your story, bringing your babies. It's been a real pleasure.
Thank you for having us.
You're welcome. So just some takeaways. I would recommend, what Haley said was sometimes things don't always go as you plan, and babies don't keep a consistent schedule with their breastfeeding in the first couple weeks, and it's normal. Don't stress. Try not to beat yourself up. And what Sherri said is, trust in your body, and if you're having some down thoughts, definitely talk to a medical professional. You don't have to bottle those up inside, and there's help out there, and it's really kind of common. So if we talk about it more, it becomes more and more known. So that's about it, and thanks to these two for coming on. So cute. So, bye.